Welcome to Breaking the Cycle of Poverty, featuring Jay Height, Executive Director of Shepherd Community Center in Indianapolis. My name is Tim Swearens, and I'm your host for these conversations that explore why poverty remains such a persistent problem in the United States. On this episode, Jay and Senator Todd Young discuss legislation designed to help working families better support their children through an expansion of the federal child tax credit. Jay, will you introduce Senator Young to our listeners?
Yes, I appreciate that I can introduce him as a friend, as someone who I have great respect, having served our country in the military and now answering a high call of serving in public office. The greatest compliment I could give to our senator is that throughout COVID, the senator would not only stop in and check on us and check on our neighbors, but would call and ask the question, how are folks? And so I appreciate that connection. And Senator, I know you're very busy, lots of demands on your time. So I appreciate your interest in our neighbors.
Yes. Senator, welcome to the podcast. And I'll echo Jay, thank you for your time this morning. The legislation you introduced would enable families to receive the child tax credit starting with the first dollar they earn. Why is that important for families?
Well, thank you again both for having me on. The Stronger Start for Working Families Act responds to the fact that the cost of child care is just through the roof, really nationally. In fact, for most Americans, the cost of child care, if you have children, actually exceeds the cost of health care. So for as much time as we spend talking about healthcare, and it is a very important issue for your lower income Americans and working class Americans, they spend more for child care. But comparatively, I find there's not enough attention on this public policy challenge. So one to my mind, easy to fix anomaly in our sort of structure of laws to deal with child care is by addressing the child tax credit. The child tax credit is one of our most effective tools we found historically for helping lower income families make ends meet and get stability in their lives. State of Indiana has 156,000 kiddos who don't have access to child care. So that's a lot of stressed parents. It's a lot of instability for children who are in their formative stages of development, and we would all benefit from a more secure system for them. And so many of these parents work non-traditional hours, or it's early morning or the late night shift at Walmart, and that's about half of the parents. In fact, 43% of them, and there are especially acute challenges for that group. So basically, what I propose doing through this Stronger Start for Working Families Act is making sure that every Hoosier, every American parent who's given us the blessing of their children and will receive the full value of the child tax credit, even if their income isn't currently high enough to maximize a refundable portion of this child tax credit. Under current law, there's a portion of the child tax credit, $1,700 is refundable to lower income families. So if they don't make tons of money and therefore aren't paying a whole lot of taxes, they get up to $1,700. But for the lowest income Hoosiers who are out there working, by the way, so many of them out there working, they're ineligible to receive that refundable tax credit until they hit a higher threshold. So this could put, just to close out my initial explanation here, this could be a tax cut for 3.5 million families, and this could cause a single parent in the state of Indiana that is a low-income person and is doing their best to raise 2 kiddos, they could see an increase in their annual earnings by $375. That's real money for these families.
Yeah, that makes a big difference. Senator, one of the things that I'm excited about this bill is you're actually working with someone across the aisle.
That's right. That's right. And in fact, I anticipate this to be a broadly bipartisan initiative and receive the support, if not of every Republican and Democrat in the Senate, then darn near close to it. So I've historically tried to find issues where that lend themselves to bipartisan cooperation. In this case, Maggie Hassan of New Hampshire has expressed a great interest in these kinds of issues, and I know that she and I will be partnering on this effort.
We hear a lot of talk about affordability. This would seem to be legislation that would, have practical application of how to make things more affordable for some of our lower income families.
Well, that's right. There's appropriately a lot of conversation and attention on affordability right now, and there's some obvious things we can do. We can continue to focus on regulation. We can encourage our businesses through various means to invest in capital equipment, make their workers more productive, and that also lowers the price of things over time. But this is a no-brainer. Would be a very targeted effort to fill a gap in existing law and help our lowest income parents pay for childcare. I mean, for those of us who have been encouraging every American adult, every parent for years, where possible, to work and to know the dignity of work and to support their families. Well, we can't say that and then not support their efforts to put their children in an affordable, safe, enriching environment, because those children are also our children. That's another important point, right? I mean, this is an investment in the next generation, and there's some hard financial reasons why we want to invest in the next generation. They become taxpayers and support the rest of it, but there's also a spiritual and moral dimension to this. These are our fellow citizens. We want everyone to have a fair shot at success in life, as they would define it, and there are certain inequalities that tug at our heart, and we can do a better job, I think, at preparing our youngest people to have a very fruitful and meaningful professional and personal life just by giving them childcare when they're young, stimulating environment.
So policy discussions, but it's really about people. Jay, what would passage of this legislation mean for Shepherd's neighbors?
Well, first, I think I want to echo what the senator said. Every kid is going to be mentored. Every kid is going to be invested in. The question's by who? And this is an opportunity for parents who are working to take their own money and invest it in them. And it is the difference between being able to keep a job and be able to provide for themselves. One of the things we talk about is we want to grow capacity to reduce dependency. This is exactly what this legislation is going to do. It's going to help families who want to work, who want to take care of their kids, who want to have the choice where they can have their kids taken care of. Shepherd operates an early childhood center, and it's tough. It's a tough time to make that work. State Senator from Northwest Indiana, Charbonneau, says childcare is the new infrastructure.
Yeah, there's no question.
This is critical to the economic realities of our city, of our state, and of our country, that folks need to be working, but we got to make sure they have a safe place for their kids.
Well, I think that's right. Listen, I have a limited view of what government should ideally be involved in at the federal level. I think it should be as limited as possible. But my view is not ideological. I mean, if I were to ask people who sort of see the world the way I do, folks back home, my neighbors in Indiana, how we can make sure that people live near are able to get to their jobs in the morning. That's infrastructure, right? They'd think roads. I think that's the first thing I'd think of. But what about affordable housing? Right? If there's no affordable housing near where your kids' school are and the jobs nearby, that's a problem. That's something we should think about. And if there's no place to take care of your kids that you feel comfortable with, that's most certainly a problem. And so this is just looking through kind of an economic lens, but let's face it. This is an important part of everyone's life. You got to work somewhere. Your kids have to be taken care of. These are the basic ingredients of citizenship in a modern society, and it's no wonder some people of the most modest means, the humblest among us, feel frustrated with life if they just can't piece things together. And so we're just trying to help out the most needy by plugging this gap in existing law. And $375 again for a single Hoosier parent with two kids. And it seems like the least we can do as we invest in all kinds of other priorities here in Washington.
Senator, what's the status of the legislation?
Well, we just introduced it, and we're building co-sponsors. We're at that stage, and also seeking endorsement from all kinds of groups. And it's kind of an exciting phase for me because I'm hearing from colleagues as I approach them excitement about this. They would like to take this back to constituents in their own state and let them know that they're concerned about their neighbors who have been looking for answers as it relates to child care. We're all excited about having more answers as it relates to affordability. So the timing is right, as each of you mentioned. And then the groups. Sometimes you're over a target if you have what might be considered by my colleagues conservative groups and progressive groups coming together on an issue and saying, it's just the right thing to do. We might describe the features and the benefits slightly differently, but we all agree that this is something we ought to be investing in. Basic social infrastructure.
Yep. Well, Senator, back some time ago, you were working on evidence-based approach to social needs from
Yes.
I think it was from England that you had
Right.
looked. What's happening with that, and where do you see innovation in the world that I live in?
So we actually brought a model that was developed in England called a social impact bond. We brought it to the United States, to our federal government, and it's been being implemented in pilot fashion. So I'll get into a little more detail, but I was so fascinated by this idea of taking the very best proven interventions and highly promising ones out of our not-for-profits and our religious institutions and taking that strong evidence base we've all seen over the years. The nurse-family partnership is one great example. Central Indiana, Jim McClellan and the goodwill of Central Indiana has done an amazing job of catering to expectant mothers and then mothers after birth to teach the mother about taking care of the child and assisting them with healthy habits, and then offering counsel about the best health choices after birth during those formative early months and years, and we find that saves taxpayers all kinds of money. In addition to improving lives, and so the challenge from a public policy standpoint has always been, how do you take an intervention like that we know saves money, that we know improves lives, and scale it because it does take some resources to scale these not-for-profit interventions without strangling it with government regulations and turning it into effectively a government program. And so I think the UK cracked this nut fairly effectively. What they said, and it requires a network of contracts to make it happen. So there's some contract costs baked into this model, but implementation's gone well. So you have the not-for-profit Goodwill of Central Indiana contract with government, and it can be your federal government working with state and local. And they all identify if you hit these outcomes, if you improve health outcomes for this population, X percent, then you're going to save, you can literally calculate, at least Y dollars. And if you do that, then we're going to pay back, whether it's a bank or a philanthropic individual, anybody who comes up with the capital to offer additional services, we're going to pay them back everything it cost them out of these avoided costs in the government. So the government, taxpayers, federal, state, local taxpayers, don't have to pay as much in terms of remediation or healthcare services or whatever. So they're less Medicaid investment, right? On account of that, there's a big pool of money that opens up to pay back for avoided costs. So you pay Goodwill of Central Indiana, you pay these investors, you can pay them a return on investment. So it actually, you're bringing capitalism into solving social problems. You can make a modest profit. And so what happened in the UK is they didn't just pilot this program. They launched it nationally, and you started to see through the wonders of capitalism these consultants going around to municipalities and looking at their budgets and identifying the biggest cost drivers in those budgets. And upon doing so, they then look at the existing body of not-for-profit interventions and say, is there something we can use to reduce municipal expenditure? Because if I can reduce the burden on taxpayers, then maybe I can make a little money out of it while improving lives. So you created this whole movement of evidence-based policy making and paying people for success. And then, unlike government, if you don't actually help people in the way you intend to, there are consequences, because these contracts that are signed actually require improvement in people's lives, and the investors don't get paid back if there's not that agreed upon improvement. So there are a lot of moving pieces. I hope I've done some justice to explaining how this thing works. But its current status in Washington, D.C., unfortunately, was somewhat interrupted by the global pandemic. The Department of Treasury was appropriately put in charge of administering this pilot program. They started to choose some public health and social interventions, reducing asthma in low-income households in Fresno, California, to reduce healthcare expenditures, and maybe nurse-family partnership in Central Indiana. These are examples of some possibilities. But they had to take those Department of Treasury resources, understandably, and respond to the global pandemic. So I'm making an effort to kind of reboot this thing now in the United States so that we can realize the benefit of improved service delivery, fewer taxpayer expenditures, and more confidence in our social support program offered through not-for-profits and other similar types of institutions.
Senator, that's exciting, and I do appreciate that view that the market can bring solutions. And
Yes.
in the not-for-profit ministry world that I live in, we have ideas, and with this comes accountability that sometimes is lacking in some of the other programs.
Yes. I'll tell you, it's fascinating. Goldman Sachs, not normally, I would guess, Jay, somebody you deal with on a daily basis.
Nope.
But the big investment banks, when I was getting this through, it's just a little pilot program. But Goldman Sachs and other similarly situated and high profile financial institutions contacted me. And they said, we're going to create a division, an impact investment division, and we'd love to, if we can get this thing off the ground, start making more of these investments, because we see money to be made, right? I mean, there's obviously a public relations dimension in it for them, but and they see money being made because they actually had confidence they can take these proven interventions, and you have them, Jay, you have them, of course, at Shepherd, and scale them to better serve people than purely government solutions. So for me, that was revealing that the market was responsive to this, and it's just it turns on one's head how we think about addressing some of these problems. We should not underestimate the good that smart government solutions can sometimes do. But we have to have other tools in our toolkit and think creatively about how to approach some of these challenges. The government's had generations to work on a little differently, because one of the unique hallmarks of American society is Tocqueville told us in the early 1800s is our not-for-profit, our voluntary associations, and no one does it like America. So what was begun in the UK could be improved and I think very much more broadly adopted here in the United States if we really take the initiative. So anyway, stand by for the reboot of the Social Impact Partnership. I sort of restyled it. It's not really a bond, so we call it a partnership program. SIPRA, to Social Impact Partnership to Pay for Results Act.
I want to work in the government an acronym office where you get to make all these up. Senator, thank you. And know you're prayed for and appreciated. I appreciate your heart for Hoosiers, your heart for my neighbors.
Yes, thank you, Senator, and thank you, Jay. For 41 years, Shepherd Community has made a lasting difference in the lives of thousands and thousands of neighbors. The Shepherd team couldn't do that work without the support of donors, partners, and volunteers. To learn more about how you can help, please visit shepherdcommunity.org. Thank you for listening.